The men and women behind me in the U.S. Capitol, along with the President of the United States, Barack Obama, who's at the other end of this mall at the White House, are all working to try to come up with a health care bill that will pass muster with the American public. Well, along those lines, let's look at some new data we have in our continuing effort to understand just what Americans think about health care reform. A simple question was asked of the public: what is the number one problem facing health care in the United States today? Well, guess what we got? Costs, right at the top of the list. 38% of Americans spontaneously said cost. Of course, there are two parts to costs. One would be the overall cost, that is, cost of tests and operations and pills and all that. The other would be the cost of the individual, which would be the cost of premiums and deductibles and what have you. And we're really not sure which is which in this category. All we know is that about 38% of Americans said cost when asked this question. What comes after that? Well, too many uninsured people. President Obama and others have been emphasizing that, and 15% of Americans said that was the biggest problem in health care today. Then insurance companies, 13% mentioned those, and then 8% said the lack of availability or accessibility to health care. Back to cost again, a real key issue, and look at this. I think this is critically important to understand. We asked the American public if a list of various things would get better or get worse if a new health care bill is passed by those in the Capitol behind me. And what do you think Americans were most negative about? Cost. You see the difference there. A significantly higher number of Americans said that their costs would get worse if a health care bill is passed than would get better. Of course, costs are something that the legislators and President Obama have been focused on, but these data kind of underscore the extreme importance of cost, particularly when Americans tell us they're simply not convinced that costs would get better if a health care bill is passed. I'm Dr. Frank Newport, Gallup Editor-in-Chief.